Good afternoon, everyone, and welcome to this ACR webinar, the new MIPPA/CMS Accreditation Mandate for 2012, What You Need to Know. We have three presenters who are expected to speak for roughly 20 minutes apiece. Once all three presentations are complete, we'll have a 30-minute question and answer session. Please hold all questions until the end of the presentations. Questions can be submitted via instant message by clicking on the Questions panel and typing in your query. Questions may also be asked over the phone. To do so, electronically raise your hand by clicking the hand icon above the microphone button to the left of the panel. When you've been unmuted, you will hear an audio notification and a pop-up will appear on your screen to indicate that you are unmuted. Our moderator will invite you to ask your question, and you will then be free to speak to the presenters. Let's get things started by introducing the three presenters, starting with Pamela A. Wilcox, BN, MBA, ACR Assistant Executive Director of Quality and Safety. She joined the college in 1987 with the advent of the voluntary mammography accreditation program and has since provided professional support and oversight for 9 more accreditation programs. Pam oversees all of the ACR quality initiatives, including ACR appropriateness criteria, BI-RADS, RAD-Peer, and all pay-for-performance activities. Leonard Lucy, BA, JD, LLM, Legal Counsel, and Senior Director for Non-Breast Imaging Accreditation. He has been with the ACR since 1993, serving first as Assistant General Counsel until 2001, then as a Senior Director for the ACR Department of Quality and Safety. Mr. Lucy formerly served as Lead Medical Malpractice Attorney for the Department of the Army and as a Special United States Attorney. Finally, Krista Bush, MBA, RT, Director of the Non-Breast Imaging Accreditation Programs. She joined the college in 1997. She oversees MRI, CT, nuclear medicine, PET, ultrasound, and radiation oncology accreditation, as well as the RAD-Peer program. Ms. Bush shares the responsibility for the development and implementation of Accredit, the new online accreditation system from the ACR. Prior to joining the college, she worked for 5 years as a radiological technologist in a clinical setting. Krista is our first presenter of the day, so without further delay, Krista Bush.
Thank you, everyone, for joining us this afternoon. I'm going to start off this webinar, and Leonard Lucy and Pam Wilcox will follow me. We're going to give you a MIPPA overview, the MIPPA overview, and an overview of the new CMS requirements today. And we're also going to talk to you about what has changed in accreditation and how you can prepare for accreditation under these new CMS mandates. Also, we'll give you a synopsis of how the accreditation process works. And toward the end of this presentation, Pam will discuss some FAQs with you. We have already received a lot of questions from sites, and we were going to share those with you. And of course, we will give you some time to ask your own questions. Hopefully, at the end of this presentation, you will understand the advanced diagnostic and imaging accreditation requirements under the new CMS MIPPA mandate. Hopefully, you'll be able to identify how these new federal requirements will affect your practice, if it affects your practice at all. Also, you'll be able to address what actions your practice needs to take now in order to meet these new requirements. And hopefully, at the end of this presentation, you will be a champion for ACR accreditation because we feel that the ACR process is peer-reviewed and educationally focused for the highest level of image quality and patient safety. Okay, so what is MIPPA? The Medicare Improvements for Patients and Providers Act, known as MIPPA, was passed in July 2008. The final regs came out toward the end of 2009. It states that providers of advanced diagnostic imaging services, known as ADIS, and I'll be saying this, now we'll be saying ADIS, that bill under Part B of the Medicare Physician Fee Schedule must be accredited by January 1st, 2012 to receive payment for the technical component of these services. The ADIS programs include CT, MRI, breast MRI, PET, and nuclear medicine. Specifically, ultrasound, general X-ray, and fluoroscopy are not included under these regs, under the law. In addition, radiation therapy units are not required. For example, if you have a PET CT unit and you use the CT portion for radiation treatment planning and you do not use it for diagnostic reasons, that CT portion of that PET unit does not need to be accredited. So what does this mean for you? It means beginning of January 1st, 2012, payment will only be made if your facility is fully accredited by one of the 3 CMS designated accrediting organizations. Also means CMS approves all of our accreditation fees. They have to approve all changes that we make for those programs. And also CMS at any time can impose changes upon themselves at any time. Now let me just go back to this first bullet. And I want to emphasize fully accredited because this is important. I'll give you an example. We have our mammography accreditation program, and that falls under MQSA. MQSA, the Mammography Quality Standards Act of 1992, states that all facilities providing mammography services must be accredited by the ACR. Now, MQSA falls under the FDA, but MIPPA falls under the Centers for Medicare Services. There's a big difference here. The FDA has a provisional accreditation status, under review status, which means while the site is going through the process, they will still get paid. Now, under CMS, this is not true. There is no provisional accreditation status. You have to be fully accredited. The ACR went back and forth with CMS. We made the recommendation that they allow for provisional or under review status, but they did not take our advice. So the advice I could give you right now is to get into the process quickly because you have to be fully accredited, and you cannot, if you're still going through the process on January 1st, 2012, you will not get paid. It has to be, by that date, you have to be accredited. Also means if you're a new facility after that date, you will not get paid until you get through the process and you're fully approved. Okay, so, of course, the American College of Radiology was designated, one of the 3 that was designated by CMS to be an accrediting organization. We have some responsibilities ourselves. We must submit accreditation data to CMS. We also must submit an annual report to CMS, and we must respond to patient written complaints and report this to CMS on a yearly basis. Now, let's just talk about submitting accreditation data to CMS. If you're already in the process, you're already approved by the ACR, you're good. We are going to transmit all that data, all the approved CMS sites to CMS. And then we're going to transmit new approvals on a weekly basis. So you won't need to be sending anything to CMS. As an AO, we are responsible for transmitting that data to them. So there are some key differences among the organizations. In 2009, CMS issued these regs, and they allowed the accrediting bodies to determine how to implement the standards. So each AO submitted their own standards, and basically with a little tweaking, CMS accepted all 3 organizations' standards as they are. So, of course, there's going to be differences because we all have different processes. The ACR process was designed by radiologists and medical physicists and are based on ACR practice guidelines and technical standards. We require clinical and phantom images as well as QA and QC and an annual physics survey for the unit. Now, the IAC, they do not require phantom images. However, they do require multiple case studies per testing area. So this could add up to about 30 to 36 case studies per modality that you would need to submit. The Joint Commission process is a little different. They do not involve any image assessment for clinical or phantom images. However, they do require a pre-accreditation on-site survey before a final decision is made. Okay, so why is this important? For radiology, image quality is key. Now, this is the law. The law states that the accreditation program must ensure the reliability, clarity, and accuracy of the technical quality of diagnostic images produced by a supplier. This is pretty clear to us. They are looking at the quality of diagnostic images. For ACR accreditation, I'll tell you that the #1 reason for failure is clinical images. That's the #1 reason why a site fails. And I'm going to show you some examples of images that were submitted to the ACR for accreditation and then get into more detail about this. Now, this image came from a site that voluntarily went through the accreditation process. This is a brain MRI, and Hopefully you could see this, but there's some ghosting on the images. It's the blurriness on the outside of the images, and this site failed accreditation. Now the ACR accreditation process is basically an open book test. We give sites everything you need to know, not only to get through the process, but to get through successfully the first time around. For example, we have a document that sites receive called the Clinical Image Quality Guide that lists the minimum requirements for acceptable exams. However, as you can see from this image, that's from an exam, that sites still do fail accreditation. In addition, we tell sites that they must submit their best cases for accreditation. So if this is the best case, imagine if these images weren't evaluated by an accrediting organization, and if we just left it up to the site to self-monitor and analyze their own images. So at the end of the process, and Lenny will go into this a little bit about the process, we do provide a detailed report to sites with reviewer comments on it. So we give them guidance so that a practice site is able to implement corrective action, and the deficiency rate on the second time around reduces significantly. For example, like this site failed the brain MRI. When they repeat, they only have to repeat the brain MRI. They don't have to do everything. If they only failed this exam, that's all they have to do. So we have the data over the past 5 years. We have deficiency rates, and I'll give you CT for example. The deficiency rate over the past 5 years for CT averages about 39%. That's pretty high. That's higher than the other ADIS modalities. However, on the second time around, the deficiency rate decreased to 13%. So, if sites were only monitoring and analyzing their own image quality internally, these deficiencies would not have been corrected, and patients would have continued to receive inadequate imaging exams. So the ACR feels strongly that the best safety for your patients, you should choose an AO that evaluates clinical and phantom images. So I'll pause for a second. That was a lot of information to take in. This is an example of good quality, and of course, this site passed accreditation. So why do we want phantom images? Why do we feel this is important? Well, you can see that this is a nuclear medicine planar uniformity image that came from a gamma camera. Of course, it's uniform, should be round and uniform. However, there's a big chunk taken out of the side of this image, and that's from a cracked crystal on a camera, and that should never have been used for patient imaging. And of course, this site did fail accreditation. And why is this important? Well, there could be a mass, or there could be a cancer that's missed right there. This cracked crystal could have distorted the image. This phantom images pick up deficiencies that aren't found sometimes on patient images, so we feel that phantom images are also very important. Okay, so that's the end of my part. I'm going to hand it over to Leonard Lucy now.
So how does MIPPA affect you if you are already currently accredited? Well, there are the MIPPA requirements that you meet, and generally if you're already accredited, you've met those requirements. That's the good news. However, because now we have CMS requirements, there are some additional things you need to know about to be able to meet the specific CMS requirements. And as already mentioned, CMS is a Center for Medicare and Medicaid Services. It's the federal agency that's responsible for oversight of MIPPA. It's also the agency that's responsible for making sure that you get your reimbursement under MIPPA. So what are some of the CMS requirements? Well, first, verification of personnel qualifications for both your physicians and your non-physician staff. This is primary source verification. This is something completely new. In the past, accrediting organizations only reviewed your certificates you had on file for both your staff. Now, you're going to have to verify the credentials with the authority that issued those certifications for both your physicians and non-physician staff. This is important because if you have an accrediting organization or CMS that does an on-site survey, on-site audit of your facility, they're going to be looking for that primary source verification, not just looking at the credentials that you have on file. In addition, there are some written policies that you will need. One is a written policy on patient access to records. This means that patients will have an opportunity to look at their records, retrieve their records, and, for instance, if your facility closes, you must also have a process in place that allows patients to retrieve those records. You'll need a written policy for consumer complaints. And as part of this policy, you must have a posted notice somewhere in your patient waiting area where a patient can see how to file a complaint with the accrediting organization that's tied to that provider. In addition, you must have written policies for both staff and patient safety. Now let me go into a little bit more detail about the patient complaint policy. The American College of Radiology will only investigate patient complaint if it is written and signed by the patient. We will not investigate anonymous complaints, but we will investigate all other complaints, and we must report all of those complaints to CMS monthly beginning January 20th or January 2012. If there is a patient complaint that poses immediate jeopardy, as that term is used under MIPPA, to either health beneficiaries or the general public, the ACR must report that complaint to CMS within 2 business days. There also may be requirements to report to other appropriate licensing authorities. It could be any regulatory authority at both either the federal or state level. For instance, it could be a state radiation control authority, Nuclear Regulatory Commission, or possibly a state medical board. As Krista mentioned previously, there will no longer be any under review or provisional accreditation status at ACR. I think this is important to reiterate and mention it again, because for a lot of you that are already accredited, and for those who are in the process, you probably were under the impression that under review or provisional accreditation would still allow you to be reimbursed, since this is the way it's always been in the past, both under MQSA and under third-party payers. As already been mentioned, ACR objected to this policy, as well as RBMA. Unfortunately, neither of our concerns were heeded by CMS, so you must be fully accredited to receive your reimbursement. That means fully accredited, not under review or provisional, not in the process. Unannounced site visits. Beginning January 2012, any site visits conducted by CMS or accrediting organization under MIPPA will be unannounced. Again, this is an area where both RBMA and ACR, and as well as many other commenters, objected, citing problems with patient workflow, disruption of the facility, and so forth. Again, CMS felt that was something they needed to do, so all site visits will be unannounced. We must also submit an annual report to CMS, which will contain some, obviously, accreditation information. In addition, to make sure that you don't have a disruption with your reimbursement, we will be submitting weekly accreditation information on sites that are accredited. The specific details of some of the data we are still working on with CMS, so we don't have that particular information, and we'll provide that to you once we find out what it is. One thing we do know is that CMS will not be collecting any patient-specific information or PHI under HIPAA requirements. One area that I want to stress that Krista also mentioned before, but I think needs repeating, is compliance with federal fraud and abuse laws. Since these programs are currently voluntary, any information you submit is strictly between you and your accrediting organization. If there are any issues with that information in terms of what you submitted on your application, again, that was strictly between you and the accrediting organization. Once this federal law goes into effect, January 2012, that changes. All accreditation information submitted is then subject to federal fraud and abuse laws. So for instance, if you submit anything that is false or misleading, that information can subsequently be used to provide either civil monetary or criminal penalties against either a facility or staff at that facility. Using MQSA as an example, I can tell you that there have been several cases in the past where information submitted to obtain mammography accreditation was discovered to be false and misleading, and either a technologist or a physician actually ended up going to trial over that issue and either was subjected to civil penalties, which means loss of money, criminal penalties, which means imprisonment, and possibly exclusion from the Medicare program. So this is something you need to be very careful about when you fill out your application to make sure you're filling it out accurately and to the best of your knowledge, truthfully. So what you need to do to prepare for accreditation? First, go to the ACR website, access the online application. There's no fee to do this, and follow the instructions. The nice thing about the new online application process is you don't have to sit down and finish it in one sitting. You can come back 1, 2, 3, as many times as you need, and it takes you to fill out the application. Another thing that's nice about the online application process is it doesn't allow you to make a mistake. So when you've completed it, it will be completed accurately and completely. Designate one person at your facility to organize and submit your materials. This one person should be completely responsible for making sure that you've done everything that you need to submit and gather all your materials for accreditation. We find that this works much better than having, say, 2 or 3 people, maybe for different modalities. Just have one person. Ensure that your clinical images submitted for review are approved by a physician. This is something also that Krista mentioned earlier, but I think it's, again, worthy of repeating. We have found in the past that images that were submitted that failed generally were submitted by someone other than a physician at the facility. So it's best to have them reviewed by a physician. Because again, we're looking at your best work. If you receive a deficiency, don't panic. You also will receive instructions on what to do next on that final report and what options you will have available to you. If, in reading those options, you still have questions, you can contact the ACR and talk to one of our technologists in that particular area to help you through. At any time during your accreditation process, you can call the ACR and have your questions answered by one of our staff. Avoid the 2012 rush. Apply early for accreditation. I can't stress this enough. We should be able to get you through the process within 90 days after you submit your clinical images. But if you have a deficiency, it may take a little longer. So apply now and apply early. For those of you who are in the accreditation programs already, and you may be coming up for reaccreditation, you should be getting a notice approximately 8 months before your accreditation expires, alerting you that you need to reapply. Again, for this group, reapply in a timely fashion so that there's no disruption. Because the thing you want to avoid is any disruption of your reimbursement through CMS. Stay current with accreditation requirements. Come back as often as you like to the ACR, visit our website, look for information. We will keep you up to date with information as we have changes with our program or as we hear about changes through CMS. Now I'm going to take you through a couple of slides that will show you just exactly how the process works. First, you complete your online application. We receive it, whether it's a new or renewal. We'll send you a testing material. This takes a couple of days. We give you 45 days to complete your testing materials and return them to the ACR. In other words, this is an opportunity for you to collect your phantom images, your clinical images, and whatever information else you need to provide us with. Don't panic about the 45 days. If you find you need additional period of time, give us a call and we will give you that additional time. This really 45 days is more for your benefit to get you through the process as quickly as possible. Once you send in your testing materials to ACR, we'll receive them, look over the information to make sure that we have everything that we need. We will then send images to our viewers, both the clinical images and the phantom images. This should take approximately 30 days, unless there's an issue, in which case we go to a third reviewer, and it may take up to 55 or close to 60 days. Once we get the information back, we'll write up the final report. This takes a couple of weeks, and then we'll send that final report to you. Now, a couple of things can happen once you receive the final report. If there is a deficiency, you will be provided with information that will tell you what you need to do and what options are available for you to make sure you can correct that deficiency. Again, if you have any questions, call the ACR and the staff will help you with that. If a unit passes, we'll notify CMS that you are qualified to receive reimbursement under the program. You'll get a 3-year certificate. That means you're accredited for the next 3 years. You'll get access to the marketing kit. You'll be able to download these new ACR seals that I think you're going to really appreciate. And make you can use the marketing kit used for both your patients, your providers, and I think you'll be good to go.
This is Pam Wilcox, and I'm going to sort of do a wrap-up this afternoon. I'm going to talk about why you should choose ACR accreditation, and then we'll go over some of the high points that we've discussed this afternoon. But I think the key point that we want you to take away from this presentation this afternoon is that ACR accreditation is from your colleagues and your college. We believe that the ACR accreditation program is the gold standard in imaging. It's developed by radiologists and medical physicists who are experts in the modality, and it's based on our practice guidelines and technical standards. We believe the focus on quality and safe imaging is key in the educational nature of our accreditation process. When you submit your clinical and phantom images, they again are peer-reviewed by experts in the specific modality who have gone through a special training program on image evaluation. We believe our programs offer you the opportunity for continuous practice improvement even during the 3-year accreditation cycle. And we have a dedicated team of technologists who are certified in each modality who can help hold your hand through the entire process. As we stated previously today, we can accomplish accreditation within 90 days of when we receive your images. The ACR has the infrastructure in place, including the technical IT support, the reviewers, and the staff to move you through the process quickly. We do not require an on-site survey prior to authorizing accreditation. You can see here what the basic fees are for the various ADIS modalities, but if you apply for 3 or more modalities, you will receive a 10% discount. And for large practices, we also have multi-site, multi-unit pricing. And with our new Accredit software system, renewal is faster and easier than ever before. You just go into register and Accredit, and you will just update the information that you've previously submitted rather than having to start from scratch. And the renewal pass rate remains at a high of 75 to 80%. And again, our technologists are standing by to help you. Why should you choose ACR accreditation? As most of you are aware, in the U.S., women are generally people who choose where their families go for health care. And most women in the U.S. are well aware of the ACR mammography accreditation program and the quality that it ensures. So we believe that these women will also choose accredited facilities by the ACR for their other imaging needs. We've accredited 20,000 facilities, including 10,000 in ADIS already. And we believe that patients will continue to look for the mark of quality, the ACR Gold Seal. This can set your practice apart, and with the new online marketing kit, you can use it with payers, providers, referring physicians, and patients to improve access to your practice. So let's wrap that part up a little bit. We are asking today that you, as ACR members, become a champion for ACR accreditation. Tell your colleagues what you've heard today and why ACR is the best choice. But it's key to remember in all your discussions that deadline date of January 1, 2012. Apply early, and we'll work closely with you to get you through the process. So we want to take just a couple of minutes to wrap up and reiterate some of the things we've talked about this afternoon that we think are key points and things that we're getting questions about frequently from callers. You need to remember which modalities this applies to. It does not apply to X-ray, ultrasound, and fluoroscopy, and it only applies to sites that bill for their technical component under Part B, the Medicare fee schedule. The accreditation process under ACR can take less than 90 days from the time we receive your images. In fact, our average is right now between 60 and 65 days. Other accrediting organizations may take significantly longer. As with all the accrediting organizations, it's good for 3 years. We will send you a notice 8 months in advance of the expiration date of your accreditation, and we strongly encourage you to apply for renewal no later than 6 months before your expiration in order to ensure that you don't have a lapse in reimbursement. There will be monitoring, and CMS, as well as the accrediting organizations, will be doing unannounced site visits. However, we can emphasize again that we don't require a site visit before the accreditation decision is issued. Leonard emphasized the issue of false or misleading information. I think it's really key to keep that in mind. There is no longer the flexibility that we had under the voluntary programs for these modalities. As a facility, you have a responsibility to make sure that patients can obtain records and images even if you close down. If you have changes in your facility, including personnel or equipment, you're required to notify the ACR. But we also have responsibilities. We must submit an annual report to CMS on all the outcomes for all of our facilities. We'll be sharing facility-specific data with CMS, and we will need to respond to patient complaints that are received in writing. Many people are confused about why these requirements were limited to private outpatient centers. There was a sense of fraud and abuse in the imaging community, inappropriate or overuse of imaging, self-referral, poor quality. There was, of course, the public focus on radiation dose and safety that we've all seen in the lay media over the last year. And we expect that this requirement will ultimately apply to hospitals. And we encourage hospitals to apply now as well so that when the mandate comes out, you're well prepared. As Mr. Lucy mentioned, you can go to the ACR website for more information, but there is also open door forums on the CMS website. If you go to this link and then sign up, you will get notices when they're having forums where they will discuss how they're implementing this program. So now we'd like to open this up for questions. If you look at the bottom of this slide, it tells you how to submit your questions if you don't remember what we talked about at the beginning of the presentation.
Oh, hi. I have questions about the MRI modality.
Okay.
Okay, first of all, for the time limitation on the sequences, is that only for the required sequences?
Yes, that is. That's only for the required sequences.
Because our protocol contains additional sequences. And on our film, we only have the time the sequence starts. So I'm not quite sure how you can figure it out how long the required sequences takes.
Okay. The best person for you to call would be Teresa Branham, and her information is up there. You can submit extra sequences, and the time is only on the required sequences, but she can help you through that and specifically talk to you about your images.
Okay.
She'll be happy to talk to you about that.
Okay. Now, does all the required sequences, do we need to continue doing them after the accreditation? Because it doesn't match with our master protocols.
You're supposed to. The reason for ACR or for accreditation is to make sure that you have appropriate clinical image protocols. So yes, we recommend that you continue those sequences throughout the 3-year accreditation process.
Because, for example, for our liver MRI, we don't
I really think you
need
do best to talk to Teresa, who can actually be more specific in her responses to you.
Yeah, Teresa Branham, she is an MRI technologist.
Yes, I understand. It's very hard to get appointment with her. Okay, maybe just a more general.
Send her an email right now, and she will call you right back.
Okay, I will do that.
Okay.
I just have one general question then.
Okay.
In the presentation, you asked about you talk about the 45 days limit. What if we need more time? Do we just ask for extension?
Yes, you call the ACR, you speak to one of our technologists or associates, and they could give you an extension. The 45-day is to help you get through the process in a timely fashion. However, it's flexible, so if you need more time, please give us a call.
Okay. And one of our machines is an open MRI. So does that also need to follow the guidelines and the imaging protocols?
Yes.
Or should I ask?
Yes, it does.
It does, even for the open MRI?
Yes.
Yes.
All diagnostic equipment.
So we got to move on to the next caller, but please
thank you.
contact Teresa if you need something. Next we have William Walcott.
Hello, this is Dr. Walcott. I'm a locum tenens physician, and I know the law specifically relates to locum tenens. And it's been a difficult time keeping up with mammography things. How do they plan to follow the trail of paper and verification for the exams for MRI and CT, things like that?
I'm not sure I understand the question. You mean for keeping totals of the exams that you perform?
Yes, that's correct. How are you going to, and the verification, you say they have to be verified.
Well, the original source verification is obviously for your board certification and so forth. That would be up to the site to make sure they have that information. In terms of whether you've kept up with the number of examinations that you've read or your CME, I think being a locum tenens, it would be sort of a shared responsibility between you and the facility to find some way to collect those numbers and document what you have.
Well, that's been a problem with mammography too. Each time you go to a different place, they have to catch up to that point. Is there any possibility that they're going to have a certification for a physician that's good for 3 years, the same as the technical aspect of it?
No, I don't believe so. The accreditation really is at the facility level.
Because when mammography first came out, there was a note about physician verification, but they never augmented that. That was part of the law. I talked to them about it before, and I just wondered if there was any way to set up a certification process for physician locums.
Again, this is a CMS program, and I don't believe there's any indication that they're going to be heading in that direction. It's a facility accredited, and it's also looking, again, because it's reimbursing for the technical component, not professional.
Yes, but you have certification problems with physicians, so they fit the accreditation. You understand what I mean?
I do. I understand what your problem is. But it's an issue that is, one, again, this is a CMS program, so it's out of our control. And two, it's something that, as a locum, you really are going to have to work out with the facilities where you're actually going to be practicing.
Well, they specifically put locum tenens in there, so I just wondered if they had any ideas about how they were going to handle it.
Not at this point.
Do you know if they're going to verify or make any corrections or bring anything out about it?
No, doctor, I don't.
Is there someone we should get in touch with that we could ask that question of CMS?
Why don't you send, this is Krista, send me an email with your specific question, and then we'll see if we can find an answer for you from CMS.
Okay. Crystal? Or Krista?
Krista.
Krista, yeah, I've got your thing here. I'll do that then.
Send me an email, and I'll find an answer for you.
Thank you.
You're welcome.
All right, next caller is going to be James Allen. Dr. Allen?
Yes.
How you doing?
I was just asking about you had mentioned accreditation for interpreting physicians. I guess it's kind of the same question the last caller was calling about, but you don't know anything about that.
No, as far as I know, there is no plan right now for CMS to have an accreditation or credentialing program specific to physicians.
Okay, thank you.
All right, next caller is Rebecca.
Oh, yes.
How you doing?
Good. Our biggest question is we're a mammo facility that does breast ultrasound, and we want to do our breast biopsy. We have breast imagers that work with us, and we also have regular radiologists within the practice that rotate through here. Do they all need to meet the minimum requirement of 300 cases?
Is this for breast MRI?
Breast ultrasound and breast biopsy.
Those modalities are not mandated under the MIPPA legislation.
Okay.
There are accreditation programs, but it's not required for CMS reimbursement.
Okay, but for the accreditation, for us to complete our accreditation process?
Do they have to meet the cases? Yes, they have to meet the cases that are outlined in the program requirements.
Okay. Every physician that is part of the radiology practice needs to meet those requirements?
The physicians that are doing the final interpretation of the images,
Okay.
or the biopsy. Or the biopsy.
For the biopsy. But for general breast ultrasound?
For general breast ultrasound, for breast biopsy, whatever the cases are that are outlined in our program requirements, yes, any physician that's interpreting those exams must meet those qualifications.
Okay. All right.
Thank you.
Thank you.
Thank you, Rebecca. Next caller, we're going to have Leon Jackson. Dr. Jackson? Nope. All right. All right. So now we're actually going to go ahead and read some of the questions that were submitted through instant message. And you guys want to go ahead and get started?
Do we need to keep doing all the required sequences after accreditation? Okay, I think that was answered already. Let's see. How could I obtain a copy of the presentation PowerPoint? That will be available after today's session. Is there anyone at the ACR who looks to see if the accreditation programs for the different modalities are consistent or uniform in their requirements? For example, why can MRI send images on DVD, nuclear medicine, JPEGs, and CT as film? We do have some differences in the accreditation programs, and we are working to get them more uniform. Starting September 27th, the CT phantom images will be, you will be able to submit those on CD. And now if you'd like to submit them before September 27th on CD, you'd have to call us, call Teresa Branham at the ACR, and she could help you with that. But we are getting everything more uniform. Starting next year, we're going to give sites the ability to submit images via the web, so they will be more uniform. Let's see. Keep going. Here. Our company has almost 100 facilities, and most have current accreditation for the modalities. If a facility currently has been accredited, for example, the MRI, should we reapply now under the new process or wait until the accreditation is expiring and renew under the new process? In other words, should we draw a line in the sand and submit all 100 facilities at once, or submit them as the existing timeframes come due? You need to submit them as the existing timeframes come due. As Lenny said, we send out renewal notices to facilities that are already accredited 8 months in advance. So when you get that renewal notice, that's when you need to start submitting. As long as you keep with those timeframes, you will be okay.
I think what you have to understand is if you're already accredited, you have met, in essence, the general MIPPA requirement if you're accredited by one of the 3 organizations that have been selected. All you have to do then is make sure that you start implementing the new CMS requirements, which are basically the written policies that I mentioned earlier.
There's a question. Does primary source verification include states, licensure, board certification, residency, fellowship, training, and or medical school certificates? And this is yes, it does. I am from a hospital that will be requesting in near future accreditation for MRI and CT. Even though I don't fall under these new guidelines by CMS, such as PSV, etc., will you be applying these guidelines to all that apply short of submitting info to CMS? Yeah, our current guidelines do cover everybody that applies for accreditation, whether they're CMS site or not a CMS site or a hospital. There are some additional requirements that CMS is mandating. For example, primary source verification. That is something that CMS mandates and not the ACR. So if you're a hospital applying for accreditation, you would not have to meet that primary source verification requirement. Can I submit phantom images? Can phantom images be sent on a CD since we are filmless? Yes. The answer is yes.
Any breaks in fees for federal facilities? No. Again, unless you have multiple sites or multiple units, there might be a price discount.
Okay. Let's see. We're going to.
Do we have any more questions by phone? I think we've got through most of the instant message questions. A lot of them were duplicates, and I hope we answered everything. But if you guys have other questions via phone, you can raise your hand. Lori Garcia. Nope. Ralph Lieto.
Yes, I submitted it. I am, but the question has to do with policies and procedures that you're going to be looking at, which I suspect will be during the on-site surveys.
That's correct.
Is there a format that you expect to see for these types of policies and procedures, and in particular for the safety procedures? Do you have, what I say, subject matter or lists that you would be expecting that the site will have available for your review?
At the current time, we have no formats for sample policies and procedures. Again, this is, for us, this is also relatively new. So it's one area that we're still looking at. We will be providing a toolkit for facilities, and hopefully some of that information will be available in the toolkit. For MRI, what you can do, though, is you can go to the ACR white paper on MRI safety, and there are a lot of suggestions in there that would help you formulate a policy for MR safety.
And in nuclear medicine, there are requirements for safety under the NRC, and we would expect to just see documentation of how you implement those policies and procedures.
Okay, thank you.
All right, thank you. All right, we have one more question came in through the instant message.
This is an important question. I had a facility tell me not to say we are doing pediatric patients if we only do them once in a while. Again, I think Lenny was clear on this. This would be fraud. You need to tell us if you're doing pediatric patients, and if you are doing pediatric patients, you should apply for accreditation. However, under Medicare, I don't know how many pediatric patients are really Medicare patients, but when you apply for accreditation, you should tell us that you are doing pediatric patients.
All right, and Diane D.
Yes.
How you doing?
Okay, I missed the very, very beginning of this. Could you go over what the requirements for the physicians are to read the MRs and that, or is that in the just in the white pages on your website?
That's in the program requirements on our website. So if you go to under accreditation, all the modalities are listed on the left-hand side. If you click on MRI accreditation, you can find the program requirements.
Okay, I'll just look. I'll just look there then. Okay.
And the webinar will be available on demand online within a few hours.
Okay, great.
Perfect. All right, do we have any more questions? I don't see any more new questions coming in through the instant messenger.
Here's a question here. What are the charges for an on-site visit, or is it part of the fee structure? It's part of the fee structure. If we're going to come out there, if the ACR is going to come out there and do validation on-site surveys, we're not going to charge you.
Okay. Any more questions?
Any more callers on the phone?
No, they're all down here. She just spoke. I didn't put her hand down.
There's none above it?
No.
It's like a toolbox there.
You guys want to just...
Okay. We're just checking to see if we have any more questions. Let me just scan this.
Here's a new one.
If we did primary source verifications at our facility as part of our credentialing, does this need to be repeated? No. Then you are one step ahead of probably most sites, so that's good. Any more questions? Okay, we're just scanning the questions. Okay, let's see. Here's the question. If the site is accredited and then purchases new equipment, will CMS reimburse for exams performed on the new equipment, or must that specific piece of equipment be accredited? If your site is accredited and you receive new equipment, you are accredited. You need to get that equipment through accreditation, but as far as CMS knows, or we've already transmitted to them that you are an approved facility. You just need to, as soon as you get that new equipment, start the accreditation process. How long, here's a question, how long does it take to receive your Phantom after you have applied? Once you apply for accreditation, you can purchase your Phantom through our third-party vendors. It depends. This is why we also say to apply early, because sometimes the Phantom vendors can get backed up. Hopefully you should be able to receive it within 2 weeks, but if we have a big influx of new facilities ordering Phantoms, it can take a little longer. So again, I suggest that you apply early and you order your Phantoms early. And here's a question: is the MRI breast accreditation a separate fee and accreditation requirement if the unit is already accredited? Yes, you must apply for breast MRI separately. Why are 40 hours of initial experience required for PET accreditation but not for MRI? All of the accreditation programs are developed by committees, and they do have different requirements depending on the modalities. And the committee felt that 40 hours of initial experience for PET was important, probably because nuclear medicine residency programs a while back didn't have PET included in them as much, and now most of the programs do. Do the submitted images have to be within a specific time frame? Yes. We require that the clinical images be within a 2-month time window from when you took the Phantom images. Also, from the day you apply for accreditation, you submit your accreditation, you can go back 2 months previous to that date to get your clinical images. So if you're having a hard time getting an examination, maybe it's a specialty examination, you can go back 2 months previous from when you applied. There's a question, does this affect the professional component if the facility doesn't meet the standards? No. This only applies to the technical component. Also, can I have a summary of how patient complaints have to be documented and reported? We don't have any kind of template, but you must. We, as an accrediting organization, have to report patient complaints. You, as a site, that you do not have to. You have to have a notice in place to your patients so they know that they could either, one, complain to your site directly, or if they can't get it resolved through your site, they could complain to the accrediting organization. However, then we, as an AO, submit that to CMS. So you don't have to have any kind of template in place to submit it. We're still looking for questions. In the future, you stated that this will be required for hospitals. Does this current law require hospitals to be accredited in the ADAS? And no, it doesn't. Just answer that one. Does anybody have any more questions? We're just reviewing some of the online questions now to see if there's any that we did not cover.
Does the certification also require evaluation of tax? And no, it does not require any specific evaluation for tax. Are printed or digital images submitted to the ACR? It can be images on CD or film, depending on your capabilities.
Oh, got those.
Mm-hmm. We have a few more minutes if anybody has any other questions for us.
You can call in or submit it by.
And if you have any questions after this webinar, feel free to email any of the contacts listed on the webinar, and we'll be happy to return your email.
Seeing no more questions, I'd like to thank everyone for participating this afternoon. And as a reminder, this webinar will be available on demand at acr.org later today. Thank you.